You're listening to the ADHD Heroes Podcast, a podcast where we speak with the heroes of the ADHD community, namely educators, mental health professionals, and of course, those with ADHD themselves, to gain insights, tools, and most importantly, inspiration towards succeeding and thriving with ADHD. I'm your host, Rabbi Shmuel Reich, a high school Rebbe and an ADHD coach in private practice. Welcome to the show. Hi there. On this week's episode, I spoke with Dr. Devora Samet, a psychologist who specializes in social skills training. We discussed the direct effects of ADHD on social skills, such as not reading body language, emotional dysregulation, taking over conversations, interruptions, irrelevant comments, and cutting lines, as well as what she calls secondary problems, such as difficulty in certain relationships and low self-esteem. We also discussed an overview of different social skills trainings, as well as the model she uses, which is called red-green behavioral therapy. We discussed its different components, its benefits, how it is applied for kids of different ages, as well as for adults, and a lot more. Just a heads up that at the beginning we discussed her professional journey, which is an interesting story, but a little bit long. So if you have time, it's a good listen, but if not, the rest of the conversation begins about 15 minutes in. Enjoy! Dr. Devora Samet, welcome to the ADHD Heroes Podcast. I'm excited for our conversation today.
Thank you for inviting me. Appreciate it.
Pleasure. Okay, so let's just begin with a little bit about yourself and your background.
So, how I got into this. I always wanted to teach. Actually, I remember when I was a first grader, and on the last day of school, I said, "Oh, great! This was such a hard year, first grade. I want to be a first grade teacher." But then I was thinking, wait, I just finished first grade like just today, so I can't be a first grade teacher. It's too hard to teach something that I just finished learning. I guess I won't be able to be a first grade teacher. And at the end of second grade, I was like, wait, second grade was even harder than first grade. I want to be a second grade teacher, but I just finished second grade. I can't be a second grade teacher, but I have a great idea. I can be a first grade teacher. And this repeated itself until I finished eighth grade. And then in high school, I was like, you know what? All of high school is hard. I'll be a high school teacher. And at the end of 11th grade, a friend of mine, I lived in Seagate. We used to travel on the bus. And we knew all the girls on the bus. There was a girl who was a couple of years older than me. She said to me, "So what are you doing next year?" She said, "I'm going to teach." She said, "Well, if you're not going to 12th grade, you're not teaching. You can't teach." I was a Satmar student, and Satmar is not going to hire you if you don't go to 12th grade. Bisaka was not hiring a Satmar girl. Talmud Dvor is not hiring a Satmar girl. Where are you teaching? I said, "I don't know. We'll figure it out. I'm going to teach." I ended up, teaching. I did teach. So that year in 11th grade, I volunteered on Fridays at a special ed preschool. And I didn't care for the little kids, but I figured, okay, let's see where it takes me. And there was a woman a woman who came to the school one Friday and asked to speak to me. A teacher came and said, "Oh, there's a lady who wants to speak to you." I went to meet her, and she said to me that she's looking for volunteers. Specifically, she's looking for someone to work with her daughter over the summer in a bungalow colony. And she's looking for a modern girl. So I said, okay, let me try to see if I can find you a modern girl who can volunteer, who can work with your daughter. I came home on Friday and I told my mother that I'm going to call a friend of mine who was a modern girl. To maybe she wants a job. And I called a friend. She's like, nah, she's not interested in education. She's interested in nutrition. And my mother said, why can't you do it? So it was like, because I'm not modern. My mother said, call the lady, ask her why she needs a modern girl in particular. And, maybe she can make accommodations. So I called her up. She said, oh yeah, because I need a place for the person to sleep in another bungalow colony across the road. And it's a modern place. There are a lot of girls there. You'll be able to, whoever is going to work with her daughter is going to be able to room over there. And my mother said, just tell her that she should find a place in her own bungalow colony that's for a frum person, a religious person. And that's what I did. I called her and I told her that. And she's like, okay, fine. You know what? Start volunteering. I started volunteering on Shabbos. I learned the Sunrise program. It wasn't my style. It was too loose,
What was it?
like not. Sunrise is working with autistic children,
Right.
and it's about following their lead. So the kid is into running around the room, you run around with them. The child wants to play with stickers, you play with stickers. The kid wants to paint and paint the walls with her. And the idea is to get into the child's world and then to draw them out that way.
What were the needs of this kid?
She was a child with autism.
Right.
And with all her additional comorbidities, meaning like, it just comes along with, ADHD and with OCD and anxiety and whatever, other diagnoses were.
Right.
But so that's how I started working with her. But I learned a little of Sunrise, and fortunately, a few weeks later, they started ABA training. I trained in that, and I loved that approach. And then by the summer, they hired me to work with her. I got the job for the summer. They said they'll accommodate me. I'll sleep in a bungalow colony, in the same bungalow colony as the family. They put me up with a religious family, and for weekends. They also asked me if I wanted the job to work with a student during the school year as well. And it was going to be in the Sinai Special Needs Institute in West Colville, New Jersey.
You must have done a good job.
Thank God. And so I landed the job.
You were 17 with the 7th? How old?
Yes, of 17.
Wow.
Yeah. And then I ended up getting training. So they did ABA training up until the summer, throughout the summer. And then after the summer, Marilyn Nails was hired. It was a woman who was from Maryland. The family hired her to train me. And she started teaching me how to work with this child with autism. And I ended up working with her for the next 5 years. I was a shadow.
This kid?
Yeah. This little girl. And then it started with, I was in Sinai for 1 year, and then they switched her to Shalom at school. They wanted to mainstream her, so I worked in Shalom at school for another year. And then they ended up opening a program, a special ed behavioral program. It ended up becoming the Beacon School, or Beacon. Today it's called R. David. And so that's how this program began. At the time, there weren't any behavioral programs for children locally in Brooklyn.
Right.
So this was the first one. And I ended up going slowly from school to school. So I've been to a lot of schools over the years.
This speaking program, they started it and you were a part of it?
Yes. So I was part of the furniture. I was coming with a student, wherever the girl traveled, I traveled. So she was in West Colville in Sinai. I was in Sinai. She went to Shalamet. I went to Shalamet. They started the program in Shalamet school. So I came along with her. They hired, again, Marilyn Nails was training me at the time. And I just followed the program. Whatever they taught me, I did.
So you learned that method?
I learned the method, yes. It's actually, I eventually named it red-green behavior therapy. But Marilyn Nails taught me about red and green behaviors. She organized behaviors that way. And so that was the program I ended up using. And with this particular child, of course, we incorporated AB strategies. It was an eclectic approach. This program that Marilyn implemented, and was quite comprehensive, and it was eclectic.
Right.
So,
where are you today, and how did you get from there to here?
So, I worked for my boss. My first boss was Goldie and Lazy Wolf Leishon. They both passed away a few years ago, and I worked with their daughter, and they said to me, you know what you're doing a good job, but you need to get a master's degree. So I had started getting my bachelor's. I went to college. I was not a rebel as a Satmar girl because my mother was Russian and she was a veterinarian in Russia. She came to America. She went to school again, Turo, for accounting. So I knew I was going to college. It's just a question of when and how. And I'll do whatever it is with it. And then I ended up going back to school 15 years later for my doctorate. And I finished. And this time around, I did go for psychology because I had a master's in special ed, and I was teaching, but I preferred teaching social skills or the behavioral aspects of kids with special needs. I didn't care for the math, writing, or reading. components of teaching. And I realized, okay, it's psychology that I like, which is why I said, okay, let me pursue a doctorate in psychology. But the good thing was that in my master's program, some of my professors allowed me to do research on psychological areas of education. So, for example, I was able to do research on behavior management, or my dissertation was on self-esteem and how it affects students. So I ended up being able to combine both of my interests.
Right.
And so that worked out. And then years later, I went back to school and I finished. So,
Wow. What precipitated going back to school?
because it was always a dream. I was like, I had to go. I was driven. Like I wanted to go for the degree. Plus, I kept getting referrals over the years for more and more complex problems in children that
Right.
I knew I was not qualified or skilled to teach.
Right.
And I would tell parents, sorry, I'm not qualified to work with eating disorders, or I don't know how to treat depression. I can't do it.
Right.
And they're like, oh, you figured out, like you figured everything else out. I'm like, I'm sorry, I'd love to, but I can't. It's just not, it's not ethical. It's not the right thing to do. But one day I'll go to school and I'll learn. So in my mind, it was like, okay, you have to learn more techniques and you need to get the right degree. And then you'll be able to help the different families. So that was also like in the back of my mind was like, I need to learn more. I waited for my kids to grow up. They were teenagers. It was like, okay, great time.
Right.
Go back to school. And that's what I did.
Amazing. When and how did you pick up on the fact that you were more interested in social skills?
So when I was working with my student, like when she was like probably in the first year, we had goals for like play skills, and we had every game. For every game I made a little index card, and I wrote on the index card, okay, these are the skills, these are the goals, this is how we're going to do it.
Right.
Every lotto game to Candyland to any toy that she had, I did that, and I was like, wait, this is like not regular teaching. This is like I'm teaching her skills,
Right.
but I like this game stuff and playing and socializing, and this doesn't seem like it's education per se.
Right.
And I was like, at some point I realized, okay, this is psychology, more like psychology.
Right.
And I enjoy, and also I took courses in my master's program. I took courses, and we didn't have any specific courses that targeted social skills. And I'm like, okay, so I guess this is not education, pure education.
Right.
So that's I came to. Also, the truth is, when I was in undergrad, I did a dual major, psychology and education.
Right.
So for purposes of graduate school, I was able to use my master's, the major in education for my special ed degree. But I realized I cared less and less for those courses. But I happen to have enjoyed the psychology courses in undergrad, which was the other major. So I ended up using all my courses from undergrad, the other major, towards my doctorate 15 years later, and they took it. It was acceptable, and
that's amazing.
Yeah.
Okay, and this has been one-on-one. You've been working with kids one-on-one.
So I've been working one-on-one. Over the years, I've been doing groups also.
Right.
Years ago, I did special ed groups as well. I mean, I still do. Like I get invited to different schools. So it's one-on-one and groups and families.
Interesting.
And teams. I'd say.
Yeah. Okay,
I work on teams, and I guide them also. I supervise. But yes,
teams. What sort of teams?
Teams, like a team of professionals. A team.
Right. You train professionals.
Yeah. So I'll be invited to work on a team with other professionals from another organization or agency, and they just need some guidance. And I'll work with them, find out what they've been doing, watch the kid, and then make suggestions and recommend different treatments or strategies.
Right. Got it.
But I also go into schools, and I do social skills groups with entire classes. So I've done that.
In the realm of special ed, or for everybody?
Both. Years ago, I used to do only special ed, and nowadays I do general ed as well.
Okay, amazing. A much needed training.
Yeah. Yes. I enjoy it. I love the classroom. It's fun.
Awesome. Okay.
I like the energy.
Oh, great. Okay, so now I guess bringing it back to more details about what you do. How would we define social skills in this context, in the context of your work, like for the layman?
So to me, social skills is defined on a simple level. It's the skills and abilities you need to interact and get along well with others and be able to function in society. So it includes making friends, maintaining them, being able to work on a team. Let's say in school, if this class is doing a project and you have to work in groups of 5 or 6 girls or 5 or 6 girls or boys in a group, being able to get along with everyone, not hogging all the jobs or not being bossy, accepting that other people have ideas and listening to their uh, ideas. It's solving problems and conflicts because those are inevitable.
Yes, they are.
Um, and also understanding your own and other people's emotions and dealing with them effectively. So if, let's say, another kid gets upset, like not escalating it, learning how to de-escalate the person, or like someone bothers you, you don't have to right me flip out at them and just make it into a disaster. Some people some kids have good social skills. They just shrug it off and walk away, and it de-escalates. They just become like non-fun people to fight with. And also like figuring out how to keep relationships long term. It's not only about making them, but despite arguments and despite different people's emotional styles or personality styles, like learning how to keep relationships intact.
Oh, got it. And
So,
how would you describe why social skills are important? Why these skills are important?
so technically, we need social skills to function in every part of our lives. For
Right.
example, you have to learn how to get along with your family, with your parents, siblings. In school, you have to learn to get along with your principal, the teacher, the classmates. You want friends. It just makes life much more exciting and fulfilling. And at work, you need social skills to get along at work. Like you just can't do your job in a bubble. You have to be able to work with a team or with other coworkers. So
Right.
it's important. Also, I should mention that the research shows that when kids have better social skills, especially in kindergarten, they have better academic performance throughout the school years. They also have improved mental health, and they also have greater professional success in future careers. So, on the other hand, lacking social skills leads to being rejected by peers, becoming isolated, which leads to depression and anxiety. There's poor academic performance and lower self-esteem. So, considering the benefits and the drawbacks, social skills are quite important.
Yeah. Wow. That's a pretty big deal.
Yeah.
Okay. So since this is ADHD Heroes podcast, I got to ask, how does ADHD affect social skills?
So, if you look at the criteria of diagnosing ADHD, for example, you'll see how the symptoms map on, and if the having problematic symptoms will lead to social skills deficits as well. I'll give you a few examples. Let's say one symptom is failing to give attention to details or making careless mistakes. If a kid is not paying attention to, let's say, the body language of a person, and like they're not paying attention to the details of it, they totally miss what's going on in the social environment. So a kid is being sarcastic, rolling their eyes when she's answering, and if you're just take them literally instead of noticing the body language, uh, you miss the entire social interaction. The kid like that might be informally dubbed as like just doesn't get it, clueless.
Right.
Or let's say when kid does another symptom is not listening when spoken to directly. These kids are like all over the place. They'll make eye contact sometimes, and kids perceive them as like you're not interested. So fine, if you're not interested in me, I'm not going to be interested in you. Or when they don't follow through on tasks, as another symptom. If you don't follow through on tasks, let's say your friend asks you for a favor, and you say, sure, I'll do it. But because of your ADHD, you don't finish it, you don't get it done. They're like, you don't care about me. I asked you to do something. You told me you're going to do it. Don't keep a word. I'll forget it. I don't want to be friends with you because I can't rely on you. You're not reliable.
Right.
Or let's say you tell your friend, hey, remind me to we have to leave at a certain time because we don't want to miss the bus. Let's say they're talking, they're schmoozing, and you tell a friend, oh, remind me. And friend's like, sure, I'll remind you. And the friend gets spaced out, forgets, doesn't remind you. You end up being late because of them. You get upset. Like, okay, again, you're not reliable. I can't trust you. Another one is fidgeting. When kids fidget, classic symptom of ADHD, it may appear like you're busy with something else, you're distracted, you're not interested. or running about or climbing excessively is another symptom. Many of these kids with ADHD have a hard time just having a conversation, being in one place, being in one spot, just having a conversation. They're all ready to move on and run around. And some kids perceive it as immature, like, oh, you're immature, like you can't have a conversation, like you want to schmooze. We don't want to run around right now and be wild and silly. So these kids get dubbed as immature. Here, talking excessively. These kids with ADHD talk excessively, and they seem to be domineer in conversations. So
Right.
there's a conversation, they end up talking so much that people feel like, oh, you don't even want to hear my perspective. You don't let me get a word in. Not fun to speak to this person like that. Having difficulty waiting in line is another symptom.
Right.
And children perceive it as, oh, you're so mean. You cut the line, it's not fair. You're not a nice person. Or blurting out answers, another symptom. Makes for a lot of interruptions in a conversation. Not very fun to have a conversational partner who blurts out and interrupts you constantly. Anyway, so these are just some of the symptoms. And with the hyperactive and impulsive traits, it becomes very hard to keep friends. There's another important feature that comes along with ADHD, which is low frustration tolerance.
Yeah.
And these kids have poor emotion regulation. So if a kid with ADHD is not calm and is not emotionally regulated and gets easily triggered and volatile, kids perceive them as again immature, or let's stay away from her because maybe she's gonna get mad and she'll punch me or kick me, hurt me, because the kid is not emotionally regulated, is not calm, not dealing with their emotions effectively. So these are different ways that ADHD specifically affects social skills.
Right. Wow. So that's a lot. That's a lot of different ways. A lot of based on a lot of different ADHD type behaviors, if I'm understanding correctly. So we want to hear some good news. So what are early indications that a person needs an intervention? Like how can we catch this early?
I like to think about children's diagnoses as primary problems. There are certain things that are primary problems, and then there are secondary problems. So a primary problem might be the actual symptoms of ADHD. So a kid is spaced out or impulsive or distracted. So these are let's say the primary problems of the diagnosis. And if you want to try to ignore it to the extent you possibly can, okay, try. I mean, it's fine. We can try, see how long it doesn't affect secondary problems. Okay, so at the point where the secondary problems start going into effect, such as a kid is, let's say, not paying attention in school, so now they're they're feeling stupid or dumb, or I have problems. My teacher doesn't like me, so I get punished because I interrupted and disrupted the class, and so now my teacher, I hate school and I don't want to go to school, and when I talk, nobody wants to listen to me because you interrupted too many times. But now I don't have any friends, nobody likes me. Again, I don't want to go to school. I want to just isolate. Those are all your secondary problems. Low self-esteem as a result. So when a problem starts, when your primary problems result in secondary problems, it's we better treat it at that point before it becomes too ingrained. Also, if it starts affecting a child's ability to function within a family or school or friendships, and if a person's an adult, if it starts interfering with their work relationships, then address it. Of course, we don't want to wait until work, but yeah, when it's interfering with their ability to function, it's time to intervene. And don't wait for it to become too severe as secondary problems, because secondary problems are much harder and more expensive to treat than primary problems.
Got it. So is there a particular age that people want to be looking for these sorts of symptoms, or you know when something's off?
So generally, I hear parents saying that the problems started already in preschool or playgroup. Since in playgroup, they were already commenting on it. The kid was a little more wild. It wasn't able to sit and play with other kids, grabbed other children's toys. For some kids, it starts showing up if they're not the impulsive type, but they're the inattentive type. It starts showing up in school when they're supposed to start reading and doing their math and writing assignments, and they can't focus and get it done. So it starts showing up in elementary school, early elementary school. So that like those are the times when you say, okay, let's address it because, without treatment, it usually doesn't get better. So it should be addressed.
Got it. Are there things that tend to come up as that can be false alarms?
I'm sure, yes. So things that are like, false alarms. Well, technically, kids can be, let's say all kids can be disruptive a little bit here and there, or they can not pay attention at times, or they can lose a friendship because they did something that they shouldn't have done. These little little things like that can happen, and those can be within the normal realm. However, when it becomes excessive and too many people are complaining, or it's affecting the child, the kid's like feeling horrible about themselves. The kids like again feel like they have no friends and they're miserable, and I feels hated by the family members because everybody's picking on me, everybody's complaining about me. And then at that point, you say, you know what, maybe it's time to treat it.
God, are there particular lines or just a sense of the situation? Lines where somebody needs an intervention, where like they cross a certain threshold. Obviously, extreme things, for sure do, but even things where you feel like where you cross a certain threshold that even if it's not so severe, where you say, okay, wait a second, we need to step in here and do something.
Right. I think that it really depends on the child's home environment, school environment. Like it depends on what the expectations are and whether or not the child is meeting those and how it's impacting the child. In other words, suppose a child is in a Montessori program, so the kid doesn't have to sit in one place.
Right.
And they're able to move around. Maybe some of their ADHD symptoms might not be so recognizable, and they can get it, and it might not be so problematic because the kid is moving around, which is great for a child with ADHD. And so it might, in that case, it won't be a problem. But let's say a parent wants to keep a kid in a certain school environment,
right.
and these are the school's requirements. Like you have to be able to function within that school setting. It's a trade-off. Like parents might decide, you know what, if I want my kid to stay in this particular school, I don't want my kid to go to another school. I want my kid to stay here. Then they may have to address it at that point. Same with the family. If it becomes like too disruptive, then you say, okay, we should treat it. It's interesting because I spoke to a friend of mine who has a child with special needs, and today he's an adult, which said really the victims of a child with special needs very often is the unseen victims is the siblings. They suffer a lot, oftentimes, from having a sibling with special needs. So many accommodations are made, or like say an ADHD kid. They break your stuff, they take away your things, they come into your room, they barge into your room, they're dominating the conversation at the Shabbos table. It's mayhem at times, and the siblings suffer. She's like, they should do research on it. And I was like, you know what? When I was in grad school, there was a classmate of mine who did research on that. She did a dissertation on having a sibling with special needs. So I guess it depends on the environment and how the family is set up to accommodate the special need, the ADHD-ness, or how it's impacting them, to what extent. It's also like ADHD is a spectrum. It's not like, every kid has, think about 0 to 100. 100 is like a very high ADHD symptoms, and
right.
0 is like very low. It's not all kids have 10. Some kids have like 100. Some kids have 90. Some kids have 12. Depends on how it affects the child's life and the family and the people around them.
Right. So if I'm understanding correctly, it sounds like you're saying it depends on the combination of expectations and how it's affecting everyone else. Am I getting that right?
Correct. And also the child's level of symptoms.
Tell me more.
Meaning, if a child has fewer symptoms,
right.
Let's say, like you said before, that you can have a low level of symptoms and still need treatment, and vice versa, I'm guessing. But let's say if a child has a low level of symptoms, but like not so many symptoms, but whatever symptoms they are, they're pretty intense, and it's really affecting the child and everyone in their environment. Then even if it's a low level of symptoms, like a few symptoms, but it's intense, you treat it anyway.
Right.
So it depends on the child's symptoms as well, not only everyone else around them.
Got it. Okay, so let's talk interventions. So you mentioned a couple before. How would you compare and contrast the different interventions that you've mentioned? We'll dive in more on the one the one you focus on the green light and the red light, but just the general interventions that are out there. What's the overview?
So for ADHD, let's say to treat ADHD and social skills particularly,
Yeah.
There are different social skills training programs. Let's say, besides mine, the red beam behavior therapy, there's social thinking by Michelle Garcia Winner. Dr. Jed Baker has a program also that has, I don't know all his programs, but I know, let's say one of his books has positive and negative behaviors, which is similar to red and green behaviors,
Right.
like stop and go behaviors. There's the Pierce program. There's the RDI, Relationship Development Intervention program. So there are a variety of different programs that are available specifically to teach social skills.
Right.
In addition, kids with ADHD need executive functioning training, so they need different skills for that. There's CBT, cognitive behavioral therapy. For example, for kids who have negative faulty thinking, like they have negative thinking, but it's not accurate, then especially regarding relationships, then CBT would be effective. There's a big component, like a big important intervention is parent training, and it's about teaching parents how to work with and manage a child with ADHD so that they can succeed.
Right.
The kids spend a lot of time at home, so parents can have a strong positive impact on children. And of course, there's medication.
Right.
So that's another intervention that's oftentimes important.
How does the medication help with the social skills?
Well, the medication slows down the impulsivity and is supposed to improve attentiveness. So all the symptoms that were problematic because of the impulsivity or the inattentiveness are reduced. And once the symptoms are reduced, the kid can interact better, not be impulsive, not do things that are hurtful, not be so forgetful, which leads to, again, improved relationships because they're doing all the right things that children appreciate and make for better friendships.
Excellent. Okay. And so the social skills trainings specifically that you mentioned before, right at the beginning, Michelle Garcia Winner and the other ones. What are those generally? What are those approaches, just generally speaking?
So Michelle Garcia Winner's program is about social thinking, helping
Right.
children take perspective, getting a bigger picture about what's going on for other people also, so that kids learn what's expected of them. Michelle Garcia Winner is also into expected and unexpected behaviors.
Oh, that's interesting. Okay.
Yeah. So, in this particular situation, what would be the expected behavior? So, let's say your friend your friend wants to tell you something right now. She went on a trip and she wants to tell you about her trip. What's the expected behavior? Just listen quietly. And the unexpected behavior is to interrupt and tell her about your trip because you're excited to share about your own trip. That's like no, it's a no. So that's like, let's say, Michelle Garcia Winner's program, and it's just one little component of it. Jed Baker has a similar program where also he didn't call it expected and unexpected. He called it, I think, positive and negative behaviors. I'm not sure. I have the book, but I haven't looked at it in a while.
Got it. Okay. Let's take a look at your approach. So,
Sure.
I guess, what is it and how does it differ from the other ones?
Yeah. So it's named Red Green Behavior Therapy, or RGBT.
Okay.
And the major premise is that we classify behaviors for children in terms of red, stop, green, go. So there are red behaviors that we need to stop doing and green behaviors that we should keep doing and doing a lot more of. There's the yellow, which is the feelings that a person has. And it's sort of a moderated, like it's in between your red and green, meaning if you have a feeling, you can decide to choose, do you want to proceed with a red behavior or green behavior? So for example, you're angry at a kid in your class because he bumped into your desk. You can either be like ADHD impulsive, punch him for bumping into your desk, or you can say, hey, the red behavior is to punch, green behavior is say, hey, you bumped into my desk. Can you please be careful next time you walk past my desk? And that would be a green using your words. So each problematic behavior is broken down into like, these are the reds, these are the greens. And it teaches children what they should be doing, what they shouldn't be doing. It essentially teaches them what's expected and unexpected. And it teaches them the positive and negative behaviors, but it's done in a colorful way, in a way that the brain can handle the information, can handle a lot of information at a time because it's organized as either red or green. So in other words, there's a theory called cognitive load theory, that a brain can only handle a certain amount of information at a time.
Like where phone numbers come from? They say seven
Exactly.
digits?
Yes.
Right.
It's 4 plus or 1, plus or minus one, one piece of information. So like if you have to memorize a number, it's like 3879827. For example, 387 is 3 digits, and the next set of digits is 4 digits. Because it's 4, give or take 1 piece of information, people, that's why phone numbers work that way. And with kids who have to learn a lot of social behaviors, if we teach them a whole bunch of like behaviors they should not be doing and a whole bunch of behaviors that they should be doing, and it's not organized in any particular way, it becomes overwhelming for the brain. It's like, how am I supposed to remember everything? But if a child has to just remember either it's red or green, it's just 2 categories. That's all it is.
Right.
And for many children, these behaviors become very intuitive. Like they realize what's red and what's green. They have no problem learning 20, 30, 40 behaviors at a time because it's just 2 categories.
Oh, interesting. How does that work? Meaning, but having 2 categories with dozens of things in them, how does the brain take all that in?
Because again, it's not like you have to learn a whole bunch of new behaviors and a whole bunch, it's not like a gazillion new concepts. It's a matter of like, is it red or green? So that's number 1. There are sometimes concepts that we teach kids that they don't understand, and we do have to explain it. So for example, relevant is green, irrelevant is red. Now, many children have no idea what relevant and irrelevant mean, young children especially.
Right.
And kids with ADHD very often will throw in irrelevant ideas because they weren't paying attention to begin with as to what was going on in the conversation or what was happening in the room. And they'll just throw in whatever they want to say.
Right.
Very irrelevant. So they need to be taught that idea. In red and green behavior therapy, we draw pictures for children to explain concepts. So really it has 6 steps. This red and green behavior therapy. It's label the behavior. So we label each red and green behavior. We then draw pictures.
Does that work by scenario? Meaning labeling red and green behaviors. I assume you're not. I assume you have some sort of starting point. Otherwise, it would just be all the behaviors in the world, which I assume is not what you're doing, right?
Yeah. Problematic situation. Yes, definitely. So we see a problematic behavior, it's a pattern, like happens again and again. We say, got to address that one.
Oh, so you go by real life scenarios, meaning situations that they experienced, something didn't work. What would be the red behavior? What would be the green behavior?
Exactly. Totally.
Awesome.
Yes.
Okay.
Yes.
Got it. So now that creates a framework. That creates a natural framework?
Yes.
Amazing. Okay.
And we're also looking for patterns. Like if a particular behavior becomes problematic repeatedly,
right,
and we say, got to address it. It's happening too many times and it's causing problems. It's like the same idea, like when you decide to treat ADHD, it's like when you decide to teach certain social skills, well, when it's causing problems for the child within their home environment, within their school environment, between their friendships.
Got it. Okay.
Yeah. So the 6 steps are to teach any skill, we label the behavior, draw pictures of it, model, like the teacher or the adults model.
Right.
We have the child practicing is 4. Step 4. 5 is reinforce. So give rewards, praise, encouragement. And 6, label, picture, model, practice. Sorry, maybe I missed the practice. Practice, reinforce, and correct. So those are the 6 steps.
So correct is for next time?
Correct is for like a correction, a consequence. Yeah, correct is for next time. Now, do we have to do all the 6 steps every single time? No. Sometimes just labeling the behavior for kids is sufficient to make it stop.
Right.
But sometimes you have to add on the pictures. Sometimes you have to add on the modeling and the practice and the reinforcement. And then sometimes, not always, but sometimes you have to add on the consequences. For many children, I don't consequence 40, 50 behaviors at a time. I never do. If I'm consequencing against like 2 to 3 behaviors that are getting consequence, but the rest of them get reinforced. So a kid can learn a whole bunch of behaviors, and as they're doing a variety of different green behaviors, positive behaviors, we just keep reinforcing it, which makes the behavior occur more and more often.
Right.
But if the problematic behavior happens and it's the chosen ones, the ones that we're targeting, those will get consequenced. They'll have a correction for them.
Got it. What's the significance of the drawing?
For many kids with a variety of different special needs, and like when I say like like an ADHD kid has a special need, I mean like their attention deficit is creating a special need for them. Many of them are not auditory learners, so you tell them stop doing this, don't do that. You cannot keep interrupting. Stop. Don't you see how the teacher's getting upset at you? All of those messages are verbal. It goes in one ear and out the other.
Right.
Not very helpful.
Right.
Many of these kids are visual learners. So if you draw a picture for them and you explain a concept that way, it suddenly clicks in their brain and it's like, oh, that's what you meant?
Right.
Oh, I can do that. That's like not a big deal. So it makes it concrete. It helps to explain abstract concepts. A lot of the social skills are abstract concepts.
Right.
Like, for example, say disrupting. How do you define disrupting or relevant and irrelevant? But you can draw a picture of it and suddenly it's very concrete.
Right.
So that's the drawings are crucial.
And drawing and modeling do that in two different ways?
So we draw a picture. That's
Right.
all I need usually is like paper and markers. That's all I need
Right.
to go to work. And look, now there's like an iPad with an app that has notes, drawing.
Right.
And the modeling is usually with puppets. And if we don't have puppets, I use markers, pens, anything I have in the room that I can use as like little puppets, and we just act it out. And then I usually like for the kids to practice it also,
Right.
so that they can demonstrate an understanding of the concept that I just taught them.
Right. Does the modeling add something like a different dimension than the drawing did?
Absolutely, definitely. So think about learning styles, the way people learn.
Right.
And if you're familiar with the VAKT, visual,
No.
auditory, kinesthetic, tactile teaching modalities.
Okay.
Educators, like this is what I learned in school, to become a teacher. But children learn through visual, like you show them pictures or video clips that like the visual component. There's auditory, listening. So when someone talks to you and explains something to you, that's the auditory part. Kinesthetic and tactile go usually together. Kinesthetic is movement,
Right.
and sensing, and then tactile is touching. But in education, usually they go together. So if you actually do something hands-on, that's kinesthetic tactile. Many kids are not auditory learners, but we tend to teach in an auditory manner.
Right. We do.
Nowadays, teachers have gotten much better at like trying to incorporate all different learning modalities,
Right.
Especially for social skills. Trying to teach social skills through the auditory modality, just telling kids what to do, we know it doesn't work, because if it did work, their social skills would be resolved.
Right.
People always giving them like lectures, don't do this, don't do that, don't you see it?
Right.
But if you do the visual and the kinesthetic tactile techniques, where you actually, if I model for you, you're seeing it, you're hearing me, it's becoming live.
Right.
That registers in the brain much more powerfully than either visually alone or auditory alone.
Oh, interesting. So it's an entirely different modality, the visual versus the tactile, and that you're hitting at both.
Yes. And having the kid practice it is, again, KT is kinesthetic tactile, and the visual and the auditory. It's like all combined together, because the kid is seeing themselves, they see themselves doing the right thing. Much more powerful.
Right.
Yeah.
Got it. Wow. What does the timetable tend to be for these sort of interventions? How long does it take for a kid to mainstream if these are the issues?
Well, mainstream is one question. Well, how long does it take for you to see progress? Let's say with my program in particular.
Right.
Okay. So with my program, generally, you'll start seeing kids within a week. Like I work with these once a week. But if the parents, I usually have parents that watch my sessions. They sit in and they watch my sessions.
Right.
If they're implementing it as well, you'll start seeing the brain gears turning. You'll start seeing child saying, like right before they do an action, they're like, I should do it, I shouldn't do it. Like they stop themselves.
Right.
So you see, you see that kind of improvement in the sense that there's self-awareness.
Right.
So that's pretty quick. And if we again implement a reward system pretty soon thereafter, and the kid wants the rewards, you'll also see progress, because the kids getting the rewards. And if they're getting consequences, they for sure don't want it.
Right.
Assuming that consequences are designed so that the kids don't want it.
Right.
They're aversive enough, and they're like, okay, it's not worth getting consequences. And I like the rewards. Let me just change my behavior. So you'll see reward, you'll see improvement pretty quickly.
Like
Doesn't
few sessions?
necessarily,
Like
within
within,
within 1 or 2 sessions, you'll start seeing changes in behavior. Definitely. Now, does it mean that the child has been cured? Absolutely not. There are a whole bunch of behaviors that have to be addressed. And in each session, we're addressing a number, like, 2, 3, 4 behaviors at a time.
right,
So, and then in each session, subsequent session, we're also reviewing the old and adding on new. So, the old, subsequent sessions are, spent also on reviewing the old, plus adding 1 or 2 more behaviors, assuming we have time for it. We make time for it, but it has to be cumulative. Like, you have to keep adding on new behaviors and making sure that the old behaviors are still maintained and generalized. I didn't mention this, but a big problem in social skills training is that there are 4 steps to learning. Is acquisition, you acquire a concept,
right,
then you become fluent at it. That's step 2. 3 is maintenance. You have to maintain it over time, and then generalization. Generalize it to different environments. We can easily do acquisition, we teach you with the red and greens, but the kid needs a little time to practice to become fluent,
right,
and time determines if the kid is maintaining it. And we have to ensure generalization, that the kid is applying the skills. Like, let's say I worked with them in my session. Can you apply it at home? Can you apply it at school? Can you apply it at camp? And so for some kids, it's difficult. So we keep working with kids to make sure that it's generalizing to different environments. And of course, it's being maintained over time. So as far as progress, we're seeing progress we want to look for progress in acquisition, in the fluency, in each of these areas, in maintenance and generalization.
right. So if a kid comes to you in like first or second grade, how long will they need to be working with you? Like, what can a parent expect?
Right. If it's ADHD alone, it also depends on this, the severity of the symptoms. As we said before, not every kid has the same level of symptoms.
Right, sure.
But very often kids with ADHD have other diagnoses also,
Right.
and that there are other factors that contribute to it. So I can't answer that question. It's not like I can say, sure, I have I done a kid in 3 sessions? Yes, but it's unusual. It was a mother
Right.
who happened to have been a professional herself, and she learned the method and she started doing it. I didn't believe that the kid actually made so much progress, but I ended up doing an evaluation for another child in that same school a year later, and I found the kid sitting there so quietly. And I'm like, wow, the kid really improved. Wow, it was amazing.
Right.
But that's not the usual. Have I seen kids improving in 5 sessions? Absolutely.
Right.
But is that the norm? Also not the norm. One of my students, actually, I went to a wedding a few months ago, and it was a girl I saw for 5 sessions.
Right.
ADHD, but must have been a mild ADHD many, many years ago. She was a young lady at that point. I started dancing in the circle, and a girl's like, oh, are you Devora Samet? I think you were my therapist when I was in 2nd grade. And I'm like, she reminded me, like, oh, yes, of course, that 5-session kid. And her mother told me she was doing great. Years earlier, I knew the mother, so she gave me updates. But she looked like a beautiful, young, amazing young lady, and it was a 5-session kid. But that's, again, not the typical. If someone is coming with a whole bunch of different behaviors,
Right.
it'll take longer. If they're coming with 2, 3 behaviors, that girl who came for 5 sessions, it was like a couple, literally like 2, 3 behaviors that needed to be addressed. She
Right.
she was a mild kid,
Right.
so it got resolved pretty fast.
Is there an average timetable that you tell people before they start working with you?
So honestly, I cannot give a timetable because it really depends on what other symptoms are coming along with the diagnosis. And as I mentioned earlier, like, some kids have fewer symptoms, some kids have more symptoms, some kids have lesser intense symptoms, some kids have more intense symptoms, and depending on what's presenting, that determines how long it's going to take. Some kids are also more cooperative like their personality type is to be more cooperative. They're less resistant. And so those kids will improve faster. Whereas kids who are more resistant and fight therapy, those kids will take longer to improve because I have to teach them skills plus deal with their disinterest and um, lack of willingness to cooperate. Again, they're it's okay that they're entitled to resist it to some degree, but it's just going to make it take longer. It really depends on what's going on. And also how many skills is the child lacking? Is it a bunch of social skills? Is it only 2, 3 social skills? Is it executive functioning skills on top of it? It all depends on the array of skills that are missing or deficient that need to be addressed, and the child's personality. And also, like, let's say if I'm working with a family, are the parents able to implement the strategies quickly, or do they have a hard time with it? If I'm working with a school, are they having an easier time working alongside, or are they like, do they say like, they're not able to give individual attention to each particular student, and so it's harder for them to implement it. So then in that case, it takes a little longer.
Got it. So are we talking about a range of like a handful of sessions, like you mentioned before, ranging to like a few years?
No, it's never years. My goal is never years. Not with a child who has ADHD. If you ask me about kids with autism, yes, it's years. If
Right.
you ask me a child with Down syndrome, yes, it'll take me years. And I don't have to be involved all the time, even for those kinds of kids. I can just train staff, and then at some point come in for consultations. But with the child who has ADHD, it's not years. Let's say it's a year and a half, that I'm making sure that their their behaviors are in check, that they're cooperative, they're not being defiant, and they have the skills and tools to succeed, whether it's in class, so they need the executive functioning skills, we're teaching them that. If they need the social skills, we're teaching them those skills. It really depends on, again, which deficits do they have, what needs to be addressed, how quickly are they learning it, and how fast is everybody implementing and helping the child generalize the skills to different environments, so that we don't have to keep working with them. Also, another big component of my work, or my style of working, is that I do work with teams, and I want people to sit in and watch me. So it becomes a matter of like training the parents or the teachers to implement the strategies also, so that they don't need me to constantly work with a child. If a problem comes up and it's the middle of the week, or on a Tuesday, and I only saw the child, I already saw the child on Monday, or I'm seeing the kid on Thursday, you can implement the strategies in the interim. You don't have to wait for me to come and address it. You know how to address it as well. You learned how to do it. So that is a big part of how I do work with teams
Got it. I
and
mean,
families.
they learn from you, and then you can finish your work with a kid sooner, because you sort of handed it off to them. Is that right?
Exactly. Yes. 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 And that's super important, because I recognize that sometimes kids have a whole variety of different deficits in the variety of different areas. And if other people in their environment learn how to address it, they can tackle things a lot sooner than if I were to have to address every single one of them.
I mean, they can even intervene before it has to get to you once the team has learned the skills. Is that what you mean?
Exactly. Exactly. It's like I'm thinking of an example right now. One of my students, let's say, was having difficulty at home. She was misbehaving sometimes because she was getting bored, you know, classical ADHD symptoms, getting into trouble because she didn't have a structure.
Right.
Mom knows the style already. She created with this little girl, her own list of things to do other than screen time.
Right.
And they made the whole entire list. And they just brought it to me at the session. I'm like, oh, I love this list. It's awesome, amazing. Mom didn't wait for me to say, hey, Devora, what are you going to do about this? My kid is giving me a hard time in the evening, which only wants screen time. And I don't want her to be busy with that. I want her to do other productive activities as well. And, how do we help her? She already knew my style. She knew I was going to say, okay, let's make a list of fun activities. And then they choose it. They choose different activities. There's screen time on the list also, but it's one of many different activities. And great, amazing. You address the issue. You don't need me to address it.
Excellent. So you're not just teaching them in the particular scenarios that they're in. You're teaching them the skills, not just for themselves. You're teaching their team the skills, and so their team, their family, their teachers, whoever can help them move forward. I got that right?
Exactly. Yes, yes, yes. Sometimes I tell parents, like, you're so amazing when you're when you're done with your own children and you want to work in this field. I'll write a recommendation letter for you, or you can work on my team, or something, like, like we can work as professionals at some point. It's like some parents are just so amazing. They're
Right.
really good.
Awesome. You train them well.
They're good learners. That's for sure.
Are there any other unique applications to ADHD in your work?
So one of the things that we need to take into account when we work with kids with ADHD is that we need to take into account their symptoms. And we're including symptoms such as inattentiveness, impulsivity, and hyperactivity. emotion regulation problems. So kids with ADHD need specific strategies to help them focus despite their inattentiveness, despite their impulsivity, despite the emotional dysregulation. And we want to help them self-control. One of the interesting techniques or strategies I've learned from one of my professors, Dr. Jeffrey Glenn, was that he promoted CAR, which stands for C is colorful, A is action-oriented, and R is ridiculous. And he said, like, these strategies, when you teach and you use CAR, you help kids learn better. And I thought about it and I was like, hey, the red green behavior therapy totally is some,
Colorful, active. Right.
yes, totally action oriented and ridiculous sometimes because like we know we'll draw pictures and it's funny. It,
Right.
it works very well together. So I was like, okay, that it definitely helps kids who are inattentive. It definitely helps them with that. Poor focus totally helps them. Also, part of the program, as I mentioned earlier, we have the 6 steps: label the behavior, draw a picture, model, practice, reinforce, and correct. Those are the 6 steps.
Right.
As part of the this whole program, we're giving them kids immediate reinforcement and consequences because that helps kids with ADHD learn faster when it's more immediate.
Yeah, they're going to see the future. Right.
Yes. And sometimes they need the consequence because it's sort of like a shocker, like, oops, I did something wrong. If I got a reward, didn't get a reward, oh, okay. And that's okay. But if I get a consequence, that I don't like. So suddenly it makes kids be more focused on like, okay, I better change my behavior because I don't want those consequences. So that is part of this program and that works very well. Also, kids with ADHD need explicit instruction. They thrive from explicit instruction. And with the red and greens, it's super clear. These are the reds. These are the greens. You want to succeed? This is the way to do it. It's interesting because I don't know if you're familiar with Dr. Nahi Felt, who is called himself the ADHD doctor.
Sure. Had him on this past week.
Okay, fine. All right. I guess I have to listen to his podcast. Anyway, he talks about his ADHDness and he also says like that what helped him significantly was when things were spelled out very clearly, when he knew what was, if you tell me exactly what I need to do, what my expectations are, and and he was able to succeed. If you gave him the reinforcement, positive reinforcement, like, okay, you did this right, that helped him learn. He also said that chunking helped him. Like if you instead of like just bombarding with a bunch of stuff, it's like chunk it. Red and green chunks it to red and green. Like pretty neat. The information is very organized. When we teach social skills to kids, it's super organized. That helps kids with ADHD also. So a variety of different components of red green behavior therapy work very well with the symptoms and with the way these kids learn best. So it's been working well for many years.
Great. That's right on the money, and ridiculous goes a long way. Silly is good. We like silly.
Yes. And we have to have fun. I'd be bored out of my mind if it wasn't fun sometimes. A lot of times.
We have to entertain ourselves too, right?
Definitely. Yes.
How do you know that? How does one know that an intervention has been successful, especially when somebody is not self-aware?
So we rely on school and family reports. So we want to speak to the school, to the principals, to the teachers. I speak to the parents. Actually, on a weekly basis, whenever I meet with parents in my sessions, or if I go to the school, I meet with the teachers. We review our red and green behavior list, and it can have, again, 10, 20, 30 behaviors. We just review it. Are we doing this red behavior, green behavior? We just keep comparing, different red and greens.
Right.
And we want to hear progress on the different green behaviors. And of course, if there are certain red behaviors that are continuously happening, we try to drill down and figure out why it's continuing to happen, and we address those as well. But on a weekly basis, we're monitoring progress. So that's one way to monitor progress. But on a long-term basis, before we end services, I usually tell parents, let's make sure that for 4 weeks straight, we haven't had any major catastrophes or blow-ups or big dramatic problems, neither at home nor at school. And if there were any small little hiccups, which is inevitable, we had the strategy. The teachers had the strategies. The parents had the strategies. you knew how to deal with it. It went well, and all is well. If we have it consistently for 4 weeks, we know we've done a fine job and we can discontinue services. And of course, I always tell parents, save my number. You can always call me back if there are any questions in the future, and you need a session or two here and there. Parents will call me back and say, hey, can you teach me about this? Or can you help my daughter with that? She's entering high school now. She needs a couple of sessions for how do you make friends in a new high school? Or she's entering, let's say 10th grade, and the workload last year was a little too much and she was not successful with it. Can you give her some executive functioning skills to help her be organized with her books, materials, classes, and teachers? I'm sure, no problem, we'll do a couple sessions. And so we do that. But assuming that I give this the couple sessions, the kid just goes ahead and implements it and it's fine. So then we know we've been successful. It really depends on speaking to the parents and teachers, make sure that they're satisfied with the child's progress, that they feel they have a handle on it, and the reasons why they came to treatment are no longer huge problems or significant problems anymore. I actually go back to my notes and we'll review our list of concerns. The truth matters, every few months, if I work with a kid for a longer period of time, then I will go back every few months to see, okay, fine, this is, and we check it off. We just, this is good, this is good, it's good, great. This one is still a problem. Let's make sure we focus on this for the next few weeks to tackle this one. But we keep going back to our initial list of goals and making sure that we're actually addressing it and we're seeing improvement. And also one quick little thing. See, one of the issues that are a problem for kids with ADHD is that they don't have good self-control at times.
Right.
And I want to see the child making a mistake and say, oops, gosh, I just did red. Let me quickly correct myself. If a kid can do that, that shows that they have the self-awareness and they can have the self-control. They stop themselves, they can self-correct. And, and they redirect. So if I see that and it's awesome, amazing. And if they're doing this on a regular basis without adult intervention, we're doing good.
Right. That's a real indication that they picked up the skills.
Yeah. And also, again, it's we focus on the social skills. Are they making and keeping friends? Are they getting into fewer conflicts? But again, I would hear those reports from the school, from the parents, and the child would seem happier. She'd just, be in a better place compared to where she was when we started.
It sounds like the same clarity you have in identifying what the issues are and what the behaviors are, the red ones and the green ones, that helps you keep track of everything.
Totally. We use the same list, same old. Yeah.
Excellent. And then you have that window where you're seeing if they took off themselves, if they have taken off themselves. Excellent.
Yeah.
Is there a difference in terms of the age of the kid you're working with, in terms of how you implement this this approach?
So yes, of course. Well, as far as age is concerned, we target different goals depending on the age.
Right.
So, for example, if it's a preschool or young child, we're working either if it's a very super young child, let's say 3-4-year-old,
right,
and parents are having a hard time managing the child, we'll work a lot in the home, and sometimes we'll go into the classroom also, not for 3-year-old, but for, let's say, 4-year-old, and work in the classroom, help teachers, help kids learn skills. And so we're targeting a lot of play skills and getting along with peers, with siblings. If we're in the home and peers in school. If it's elementary school children, we're targeting executive functioning skills. We're targeting social skills at recess time or even during class between student and teacher, student and other classmates, to make sure that so again, the goals become different depending on what's expected. For teens, again, we're focusing on their relationships at school, their relationships at home, their performance at school,
right,
and how are they following through with helping at home? Are they doing chores? Are they doing what typical teenagers are expected in that community or that home environment?
Right.
And for adults, are they able to perform their work responsibilities and get along with their colleagues and workmates at work? And also, if they're having difficulty with any family relationships, we address that as well. Now, as far as how to implement it, for very young children, I speak slower, a lot more dramatic.
Right.
And, but I still use the same red and green system. And as kids become older, still use the same system, but I'm much more sophisticated in my language that I use when I use, like, let's say the vocabulary that I use for the red and greens are more sophisticated. And and I'll say something like, have you ever heard of red and green language? Do you speak red and green language? And they're like, what? What's that?
Right.
Say, oh, okay, you never heard of it? Okay, fine. I'll explain to you because I sometimes speak it and I might just slip and use that language, and I just want you to be aware of it. And I do the same thing with adults. Like, do you speak red and green language by any chance? Have you heard of it? Like, no. They'll arrive. Like, no, I don't know what you're talking about. I'm like, okay, fine. Let me just tell you what it is. And, but I do speak very matter of factly to older kids and teens and young adults. I still use the color coding because for the people who need them and for whom it gives clarity in their brain, because it just color codes into like red stop, green go, it's helpful. Now, some people ask me, seriously, you're going to do this with adults? And I did do this with adults, young adults and adults, in a college program at a hospital at LIJ, Long Island Jewish, when I did my internship there, an externship, actually. And most of the patients liked it. They appreciated the program. So at some point, I asked my supervisor, like, explain it to me, because I was doing it. They appreciated it. They went along with it. I don't remember anyone telling me, this is like so stupid, it's ridiculous.
Right.
And then she said to me, wait, remember, Devora, that this is a college program. These patients are college students and they are accustomed to taking notes and having information organized in a notebook or a loosely binder. So this is the status quo. Like, this is like, what they're accustomed to.
So color coding is not like outlandish for them?
No, it was no, not the color coding nor the fact that everything is written down. All the behaviors are written down and everything is broken down. And I drew pictures if I needed to, like cartoon pictures. I'm a cartoon artist. And so and I made it colorful just because I said, like, I'm bored of like black and white and it's hard for me to understand the black and white pictures. So I'm just going to use color when I draw. Nobody seemed to mind it. And actually, it's interesting because I had one patient who seemed to, like, she was progressing in the beginning and then she seemed, it was a social anxiety situation. Not ADHD, not ADHD per se, but it was more social anxiety. But we did the red and greens and she made progress in the beginning. And then at some point she was like, oh, it's too hard, too much work. I don't want to do these exposure exercises. And at some point she quit. But she said, she texted me, she messaged me years later, actually about a year ago. She found me on the internet, on LinkedIn or one of my social media accounts. And she's like, I still remember the stuff he taught me and it was very helpful. I went home and I did it and it really worked.
Awesome.
Someone I was like, too much work to do, and she was a young adult,
right,
a college student. And she appreciated the reds and greens because everything was broken down, like how to be assertive for an adult. The green behavior, how to be passive is red behavior. Gave her some sample statements of being passive. So even adults benefit from it. And even when I work with parents, I'll say, hey, what are our red behaviors as parents? Like yelling at our children, criticizing them constantly versus praising them as our greens, using calm voice is green. So we also have our red and greens.
Right.
The truth is my brain works like that. Like, to me, I see like things very clearly as red and green. Yeah. Some of my friends used to make fun of me like, oh, you have black and white thinking. Or like, I once got Shalchmanis, talk about before perm. Everything was black and white. And black and white jelly beans, black and white cookie, black and white. But yeah, my brain sees things as red and green. It's like, this is what kids should be doing, this is what they should not be doing. If I see a problem, it's like, oh, what's the red behavior that they're doing that needs to stop? What's the behavior that I need to teach them? Yeah, my brain sees it that way. So to me, it's easy.
Right. So that clarity benefits everyone as long as they're introduced to it in a way that's not condescending. I'm getting that correct?
Exactly. Yes. And I try to be as respectful as I possibly can.
Right.
Over the years, I had one student who said to me, I'm bored of this red and green. Can we use other colors like pink and purple? I'm like, okay, fine. So pink is red. And we were like, what's
Yeah.
what? And it was just so confusing to me. I could not. I was like, then we just chuck the whole thing because I can't. My brain, if I have to like think, okay, pink is red and green is and purple is green, like how do I know? And so maybe pink is green. I don't know. It was too confusing. But otherwise, yeah, just use red and green. The truth is, again, red and green is a universal color throughout the world.
Sure.
Everywhere in the world, red is stop, green is go. So anybody understands or is familiar with these coloring colors knows that, understands the system. And even 3-year-olds get it once they know colors and they know the traffic light. And kids love traffic light. Even little kids love traffic light.
Right.
They understand it.
Okay. Are there any books or resources that you want to recommend?
Yes. Actually, I should mention something. By the way, very little kids, like 3.5-year-olds who don't like, they know color, but they don't really get it. I won't use color necessarily. I might just say, like, this is, or for 2.5-year-olds, I'll just say, this is no, cannot do that. No biting, no hitting your sibling who's like sleeping in the carriage, like 10-month-old little baby sibling. But yes, nice word. So I just like do, instead of red and green, it's like, yeah, no.
Right.
It's
The
like a
same
matter of like
clarity and
using,
simplicity, but appropriate for
yes,
their age.
yes. In my brain, it's like, again, red and green, but without the words. All right. So as far as books and resources, yes. So as far as social skills books, Social Thinking by Michelle Garcia Winner, or even Sarah Connor Radcliffe's books on parent training are very helpful even for kids with ADHD and kids who need social skills training. Julia Cook has a bunch of different books for ADHD behaviors. So, for example, Decibella and a Sixth Voice, or Decibella and a Sixth Voice, I think that's what it was. Bad Case of Tongue. I can't believe you said that. My mouth is a volcano. There are a bunch of Julia Cook books that are really cute that teach different concepts. I wrote a book when I go on the van. I wanted to test out, like, parents have been begging me, like, publish your book. So I tried one, and it came out really cute. It has a bunch of different red and greens. One of my students who was very ADHD, and it did a bunch of little red behaviors on the van. We made a little book for him, and I took that book and I just gave it to an artist and had her redraw them into a professional book. So it's cute.
Is that available on Amazon?
Yes, it is. Yes.
Excellent. Okay, great.
Okay. Then is Russell Barkley and Alan Kasten have parent training books, and they have parent versions. So they have the professional books for a therapist, but they also have books for parent training books, and they're excellent. So these are some of the books that I recommend.
Excellent. Okay. And what's a message of hope you'd like to leave our listeners with?
The same way years ago, if someone had a learning disability and it seemed like it was hopeless, and was like, okay, you're doomed for the rest of your life. That's it. Like, you're going to remain limited until the educational world came out with like special education and a variety of different ways to teach and educate people with different difficulties. And like, nowadays, if you have, a child with learning disabilities, no longer is doomed for the rest of their lives. Similarly, with social skills training, once upon a time, I remember a family member asked me, what exactly are you specializing in? And I'm like, yeah, social skills. Like, what kind of things are, who's going to hire you? What kind of field is it anyway? So I remember saying, well, the same way as learning disabilities used to be a doomed diagnosis. And today there's a ton of services. Even this is like in 1995, 1996, like when I started out. And I believe that it's a field that has not been developed yet. And it's going to become very popular. Marilyn Nails, the person who trained me, I think she was ahead of her time, like way ahead of her time. She taught me a lot of these different strategies that years later research has come out to show, yes, all these different tips and strategies work and are effective, and why. And the research, corroborates that they're effective. So, message number one is there's hope out there, and there are a lot of different strategies that can be used effectively, and one can lead a perfectly normal life with ADHD. Actually, people with ADHD often have a high level of creativity and imagination, and the ability to accomplish a lot of different creative programs, and like they're amazing people. So great, like take your skills and abilities. We'll tweak it a little bit because you're having the side effects of ADHD also.
Right.
I'm like, there are positive side effects and negative side effects, but let that not hinder you from becoming amazingly accomplished. So, definitely like remember that you can accomplish a lot of things, and we may have to just break down skills and concepts for you so that that you can succeed and like none of the symptoms hold you back. So that's that's my message of hope.
Excellent.
Definitely.
Thank you. Okay, anything else you wanted to mention today before we hang it up?
Yes. So I would say, like, always when you're working with a child with ADHD, or if you're a parent and you're working with a child, your child has ADHD, make sure to work as a team to ensure generalization happens to different environments. So it's not enough to, let's say, work one-on-one with a therapist in the office. Make sure that the therapist is in contact with a school, is in contact with a camp, so that generalization does happen, that you see progress in different areas. Also, even small changes can make a big difference in your child's life. So, for example, some people say, like, oh my gosh, my kid has so many skills to learn. Yeah, you're right. But even if a child learns to not interrupt and listen to people in a conversation, that's going to change their relationship quite dramatically. And if they learn some executive functioning skills, like I have one parent whose daughter had, I worked with her when I evaluated her when she was in the 4th grade. And I worked with her a little bit at the time, guided the parents a little bit. And she came back now at the beginning of the year. I'm actually only one session. I was like surprised how quickly she learned. I taught her how to manage her schedule because she was in 7th grade, learning having departmental classes. So she was not managing all the books and teachers and schedules and all that. It was like very confusing to her. Did one session, taught her how to do that, and taught her how to organize her studying, or like book reports and studying, like how to put it on a calendar. And like amazingly, like the mother's like keeps thanking me, like, oh my gosh, you're a miracle worker. I'm like, no, your kid is a super bright girl. Taught her the strategies and she ran with it. She could have resisted, she didn't. She actually implemented. Mother came with a picture of how her schedule looks like nowadays, her calendar. Like let's say she has a test on Tuesday, right, and she knows that it's going to take her 3 days to study. So she has to study, finish studying by Monday because test is on Tuesday, but she studies over the weekend and she has like her 3 days she has to study. If like everything is marked and it's organized, and she's doing amazing. Actually, which reminds me, that's a strategy I learned from Sarah Ward, who's an executive functioning specialist. So that's any of her books I'm a big fan of. Any of her workshops, materials, like I love her stuff.
Okay.
So I should have mentioned that by books and resources. Also, another important thing to mention to parents: don't stop as soon as the crisis is over. Sometimes what happens is a child comes in because, they're getting kicked out. They did something impulsively in school. They got suspended.
Right.
So parents bring in a child for that particular behavior. However, there are other underlying issues or a variety of different other behaviors that are still a problem that might lead to a similar impulsive incident in the near future if we don't address it. So just because we resolved the crisis, don't stop the treatment. Like, address those other issues so that it doesn't lead to future crises again in the future.
Right. One issue is usually not in a vacuum.
Exactly. Yes, exactly. Yes.
Excellent. Okay, so how can people get in touch with you?
So several ways. I have a website, redgreenbehaviortherapy.com. They can also email me at dr.devorasamet@gmail.com. I spell my name Devora without the H. So it's DEVORASAMET@gmail.com. And I have an office number, 718-331-3601. I have a Brooklyn and Muncie office, but if you just call this one number, I can be reached at both offices.
Excellent. Okay. Dr. Samet, thank you so much for coming on today. This was fantastic.
Thank you. Thank you. Thank you for having me. I appreciate it.
Thank you again for listening to this episode of the ADHD Heroes podcast. For questions about the podcast, you can email us at adhdheroespodcast@gmail.com. Also, for sponsorships or to share your story, your ADHD story. You can also email us at the same place, adhdheroespodcast@gmail.com. To be in touch with me about ADHD coaching, writing, or speaking engagements, you can email me at rsreichadhdcoach@gmail.com. Be sure to check out my website, rsreich.com, adhdcoach.com. You can follow me on LinkedIn, or you can check out my blog on nefesh.org. Check out my blog there under my name. Important disclaimer: podcasts are great, but they do not take the place of mental health help or medical help. So if you need help with mental health or need a doctor, be sure to be in contact with some of them. Please, if you like this show, please rate, review, and share with a friend. That's how these things get out there. Thank you again for listening, and thank you to our producers at Pretty Easy Podcasts.